The Newsday continues here on One News Now. I'm Riza Diaz. The IATF is looking into proposals allowing limited face-to-face classes in Metro Manila. Education Undersecretary Nepomuceno Malaluan said NCR mayors are urging the government to allow at least one school in each city to join the pilot run of physical classes. The palace also said that they will listen to the appeals and recommendations of NCR mayors since they are the ones implementing IATF policies. Health Undersecretary Maria Rosario Vergere earlier said that Metro Manila can be included in the pilot run if cases and hospital utilization rate declined and downgraded to alert level 2. But how exactly should we prepare for the resumption of face-to-face classes? Let's find out straight from the World Health Organization.
As many countries are putting in place measures to protect students and staff and also larger communities safe and keeping them safe during this phase of the pandemic, what are WHO's recommendations to keep communities safe?
That's right, Vismita. Many countries have put in place and are putting in place precautions to keep schools open safely during the COVID-19 pandemic. Schools operate in communities, and the first thing is to make sure that we try to drive transmission down as much as possible in those communities because the individuals that work at those schools live in the communities. Second is to ensure that we have good systems in place within the school system to be able to monitor the health of the students and staff. This is a plan to be able to detect cases, to ensure that children who are unwell stay at home, to make sure that there's good communication with the students themselves, the faculty, as well as the parents, so that they know what to do if a student is unwell or if a teacher is unwell, to make sure that there's good provisions within the schools to minimize the opportunity for spread of the COVID-19 virus. This is about disinfection, it's about improving ventilation, about distancing, about wearing of masks, and if there's vaccines available in the areas to make sure that the vaccination is undertaken in those communities among the priority groups who live there.
Maria, during this pandemic, we've seen how important it is for students to have that continuity of education. Let's go a little deeper into what steps a school should take if a case is detected.
So that is a great question. It is really important that students have that continuity in terms of their education and their safety and well-being. It's about having a plan in place. First of all, if students are feeling unwell, we recommend that they stay home and that they're cared for by a parent or a guardian at home. If there are cases in the school, they need to be able to be detected so that they can receive the proper care, they can receive a test, they can receive the proper care that they're needed based upon the symptoms that they have. And then we recommend there to be contact tracing. So the same as we do in the general community, if there is a case that is identified, what we want to do is make sure that we prevent the opportunity from that virus from transmitting from one individual to another. So it's important to identify the contacts of those children, and those children be in quarantine for a certain number of days so that they don't have the opportunity to spread should they be infected. But all of that requires detailed planning by the school. It requires good communication with the students themselves. First of all, to take the measures to prevent themselves from getting infected and passing to others, but also to know what to do if they are feeling unwell or if they happen to be a case.
Vice President Leni Robredo's camp is now more focused on their campaign, but their goal of unity is still on the table. Speaking to the chiefs, her spokesperson, Attorney Barry Gutierrez, said that a united opposition is currently on the back burner, as their main agenda now is to move forward with their campaign. But Gutierrez clarifies that Robredo is still open to unite with people with the same values and principles for the betterment of the country.
Ang pagmumulan pa rin yan at iikot pa rin yan dun sa punto ng pwede ba tayong magkasundo batay sa prinsipyo, batay sa pananaw para sa ating bansa.
Meanwhile, when asked to comment on Manila Mayor Isko Moreno's remarks against the vice president, Gutierrez said that they have endured worse and that Moreno's words reflects more on the mayor than on Robredo.
Hindi naman tayo mga bata dito eh, di ba? And the honest truth of it is, hindi yan ang pinapansin namin ngayon. Nakafocus kami on doing our own thing, doing our own campaign, working with the people who have come out to support us. Because that's really what we need to do now. Hindi maganda yon, but that reflects more on him than on us.
Vice presidential aspirant Dr. Willie Ong says he will not participate in any political bickering. In an interview with One News, Ong said that he already learned about politics when he ran for senator in 2019. Unlike his running mate, Isko Moreno, who has already kicked off the political mudsliding by calling Robredo a fake leader, Ong said that the focus should be on what he can be or what can be done for the people and not on fighting with other candidates.
I've told previous interviews that I will not bash anyone. I have no plans of saying anything bad. We'll just focus on what we can do and offer this to our people.
Ong also said that he is willing to work with anyone once he wins the vice presidential post. He reiterated that they should focus on helping other people and not politics.
I will be a very balanced, decisive, and I will be very supportive of the president. Of course, my choice is Mayor Isko Moreno to be the president. I can work well with him, but I can work well with anyone.
Now, in other news, Pfizer has submitted its emergency use application to regulators for the use of their vaccine for children aged 5 to 11. More details in this Bloomberg video.
Today, Pfizer and BioNTech submitted it for emergency use authorization of their children's vaccine. And it's for kids ages 5 to 11. And there's a series of 2 smaller doses. Now, the president is set to speak this afternoon about vaccination, so hear more about the focus coming from the federal level. But let's talk to Bloomberg's Robert Langreth about health and the focus of the children's vaccine. Do we think this is going to get an all clear? Because I know many a school, many a parent is waiting very much on this.
Oh, right, definitely. This is the first vaccine to be submitted to be authorized in a pediatric dose for younger kids. This is ages 5 to 11 they're talking about, so younger school kids. And there's the potential of having this on the market, available by early November for school kids, and certainly a lot of parents that want it. But the FDA is definitely going to look at this vaccine data and safety very, very carefully, because young kids, while they can spread the virus, they're less likely to develop severe complications. And certainly at the same time, there's some indications that younger males, and in particular, are more likely to get this rare adverse event that's been reported, this myocarditis, this heart inflammation. So that's all going to be looked at very, very carefully to make sure that the vaccine is totally safe in young kids. And one of the things that's different is that Pfizer and BioNTech are going for a lower dose in the younger kids. They're going for 1/3 the adult and older teenage dose. So it's a much lower dose on young kids. But clearly, this is a big event, a big advisory panel that's happening towards the end of the month. The data is going to be reviewed in public again, and everyone's kind of waiting very carefully to see what that reveals.
Maybe talk to us a little bit about the hurdles, the differences in the hurdles between the children's vaccines approval and the adult vaccine approval. Presumably, there are a lot of parents that are waiting for this vaccine, but there are also a lot of parents that are probably going to tread somewhat lightly as to necessarily running out to get their kids vaccinated. What kind of hurdles are there for approving the vaccine that can make those parents feel a little bit more assured in its efficacy and likely side effects being somewhat minimal?
So they are applying for an emergency use authorization. So it's similar to the original emergency use authorizations for older people. Now, the Pfizer vaccine in adults now has a full approval, because they've gotten 6 months of follow-up data, and we're able to get full approval for the adult vaccine. So this would still be an emergency authorization in younger kids. But But the FDA actually made, the U.S. Food and Drug Administration actually made Pfizer and other companies go back and increase the size of their trials in the younger children in order to increase the size of the safety database. So we're talking about there are likely to be several thousand younger kids in the trials.
Let's now take a quick look at today's other top stories. Pag-asa says a tropical storm Maring is expected to intensify into a severe tropical storm in the coming hours and is expected to make landfall in northern Luzon by Monday evening. Meanwhile, Comelec will resume voter registration for the 2022 elections starting tomorrow until October 30. And a life-size bronze statue of Beatles legend John Lennon went on show in London on what would have been his 81st birthday. And those are the top stories of the hour. Join us later again at 12 noon as we continue to monitor today's biggest stories. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.